Joining us live now to discuss the latest in public health news is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, it's good to be with you again. We're talking about measles because it's making headlines every day. Cases in this province have now surpassed 1,400. I'm not sure the exact number, but we know that most of these cases are in unvaccinated children, mostly in the southwestern region of our province. We spoke with Dr. Kieran Moore last week, who expressed what a challenge it's been to kind of chip away at the vaccine hesitancy we're seeing, especially post-COVID. What do you think public health officials need to do that you're not seeing being done right now? And I understand that accessibility to these vaccines, making it easy for people to get to clinics, is a big factor here.
Yeah, certainly that's one factor. You always have to lower any possible barriers to vaccination. But when we're talking about vaccine hesitancy or individuals who might have questions, concerns, unresolved issues associated with the vaccines, it's important to take those questions seriously. You know, not taking a shaming and blaming approach, but really taking an empathetic approach, answering people's questions, addressing their concerns in a fact-based, data-driven manner, and really taking the time with individuals and with communities to address their concerns. Now, that doesn't, of course it happens during an outbreak. Of course it's happening now. But the heavy lifting of this is done well before an outbreak occurs. It takes a long time to build trust. It takes a long time to ensure that everyone is comfortable and happy with this approach. And this is not something that's just a discrete event. It happens and then it's done. These are ongoing conversations with individuals, with the general public, with specific communities, and then, of course, to your point, lowering all possible barriers to vaccinations to ensure that, hey, when someone is offered a routine childhood immunization, they make a smart decision and receive it.
Yeah, we know that it's hard right now for people to find family doctors. We know that people in perhaps lower economic kind of situations or communities, working jobs, might not have the time to go to a doctor's office or go to a public health unit and get their kids vaccinated. Do you think that these kind of rollouts or programs should be made more accessible like it was during COVID? Should this be rolled out in schools?
Well, I think certainly in areas that are currently experiencing outbreaks or major unvaccinated areas, there obviously needs to be significant resources poured into those areas to lower all possible barriers to vaccinations. And to your point as well, right? Like, you know, healthcare is stretched across the country. What's nice to see in Ontario, at least, is there's a giant concerted effort to lower barriers to accessing family physicians and primary care. And, you know, Dr. Jane Philpott, is doing some remarkable work to ensure that Ontarians are connected with family physicians. Obviously, that's not going to happen overnight, but you can see the wheels are in motion to really improve our access to primary care. That's an incredible medium and long-term solution, and that's going to do wonders for us in Ontario. But of course, we're in the midst of a measles outbreak right now. And again, to your point, I think it's a really good idea to do anything possible to lower any possible barriers to vaccinations, especially in those largely unvaccinated pockets in Ontario where the outbreak is burning strongest.
Now, fortunately, we haven't seen any deaths from measles here in Canada, but we know that there's been 3 in the U.S. According to Ontario data, only about 70% of children under 7 do have the MMR vaccine. When it comes to people who are watching the news thinking, oh, my gosh, I'm older, I might be immunocompromised, I might be pregnant, do you recommend them getting an MMR booster?
So a couple quick things. Sadly, we did have a death with measles last year. And again, that's too many. And these are preventable deaths. There's also morbidity, even if there is, I don't want to say only one death because that's too many, but there's significant morbidity associated with this. When people have individual medical questions, it's important to talk to a healthcare provider, a doctor, a nurse practitioner, a pharmacist, a public health specialist about the nuances of the individual circumstances. But in general, the vast majority of people are up to date on the routine childhood immunizations in Ontario. Not everybody, but the majority. And if people are up to date on the routine childhood immunizations, including the measles, mumps, rubella vaccine, the risk of infection is minuscule. People born before 1970 are assumed to have already been infected and recovered from measles and therefore have lifelong protection. So their risk is, minuscule. Did 100% of those individuals get infected and recover from measles? Mm-hmm. No, but probably pretty close to it. So again, if someone is an outlier or has any particular questions associated with this, and many do, you've got to get that individual nuanced answer from a healthcare provider.
Mm-hmm. Okay, Dr. Bogoch, that is our time for today. Thanks so much for your insight once again, and hope you recover from all your travels. We'll chat again next week. Take care.
Have a great day, Jennifer. Thank you.
You too. Thank you.